Nearly 9 months after the catastrophic January 12, 2010 earthquake in Haiti, the Ministry of Public Health and Population was notified of rising numbers of diarrhea cases along the Artibonite River. On October 22, 2010, the first cholera case was confirmed by the Haiti National Public Health Laboratory.
Le 19, on a reçu vraiment des selles là maintenant qui a les caractéristiques. On a commencé à préparer les milieux spécifiques pour identifier le choléra. Et le 20, le lendemain matin, on a été vraiment très surpris de voir les colonies caractéristiques du choléra sur ces boîtes de TCBS que nous avions préparées la veille. On a fait le transfert sur le milieu qu'il faut, un milieu non sélectif. Ensuite, le soir, jusqu'à peut-être vers 9h30, on a enfin pu confirmer par le test d'agglutination que c'était vraiment du Vibrio cholerae.
The population had little knowledge of the disease and its transmission, and few health workers were qualified to respond to the epidemic. The government of Haiti created an intersectoral response plan for the cholera, which focused on 3 areas: protecting families at the community level, strengthening primary healthcare centers, and establishing a network of cholera treatment centers and designated hospitals of treatment of severe cases. Based on the strategy of the government of Haiti, the Pan American Health Organization launched a donor appeal for funds to support emergency operations. The response from donors was fast and extraordinarily generous. Following the first cholera cases, the epidemic began spreading throughout the country. By November 23rd, all 10 departments in Haiti had been affected, and in December and January, the epidemic reached its peak. Partners rapidly set up a network of cholera treatment centers and units. By January, there were over 100 CTCs with accumulated bed capacity of approximately 10,000. In all, 71 NGOs and agencies operated cholera treatment facilities. In support of the Ministry of Health and Population, PAHO has acted as the co-leader of the health cluster in Haiti. The mechanism helped exchange key information, manage registration of NGOs and deployment of human resources, conduct trainings on cholera and management of dead bodies, and implement intersectoral response plans. Epidemiological surveillance was a key part of the cholera response. 2 surveillance systems, developed after the earthquake to monitor communicable disease trends in internally displaced persons camps and communities, were instrumental in rapidly detecting cholera cases and served as an essential basis in the response to the epidemic. Support was provided to the National Laboratory, and surveillance along the border with the Dominican Republic was increased. Regular trainings of health personnel were held by health authorities.
I have been requested by the government in the WHO office to come here in Haiti as a consultant for case management in cholera cases in Haiti. I am visiting the different hospitals and training the local staff there, the medical staff, which includes doctors, nurses, pharmacists, lab technicians, health workers on all levels, to teach them the basic case management principles of cholera, how to properly assess the case with diarrhea, what to do, what are the features to look for, and then how to manage them properly according to the severity of the disease, and also some simple preventive measures as well as what to do with those patients who unfortunately die.
Few teams were deployed to all 10 departments to support the Ministry of Health and Population at the local level. These teams of epidemiologists, medical doctors, and water and sanitation experts became part of an alert and response system to gather real-time information on hotspots of cholera outbreaks, determine needs for resources, and coordinate response activities with partners in the field. Monetary and material donations made to PAHO through PROMISE, the Program for Essential Medicines and Supplies, allowed for life-saving supplies like Ringer's lactate, oral rehydration salts, antibiotics, and water and sanitation material to reach all departments in Haiti.
When the outbreak started, the first thing we did as an organization, always in collaboration with the Ministry of Health, is to look at the supplies that are in the country to respond to the cholera outbreak. This was instrumental in the sense that we have the support of all of the donors, and that all the NGOs that are registered and accredited by the Ministry of Health can come and get their medical supplies free from Promise.
Since the beginning of the epidemic, over 300 tons of medicine have been distributed by Promise, including cholera treatment for over 372,000 mild cases and 124,000 severe cases. In addition, Promise has manufactured over 3,500 cholera beds. A health promotion strategy was designed to inform the population about the disease, measures to be taken to prevent cholera spread, and actions to take in case of diarrhea. It included sensitization messages on food hygiene, hand hygiene, and how to take oral rehydration salts. Prevention messages were disseminated through print media, TV, radio, and text messages. A call-in hotline was also set up to answer cholera questions from the general population. All materials were produced in Creole with assistance of Haitian graphic artists and distributed to health partners and communities. A series of norms, procedures, and evaluation tools in the areas of water and sanitation, waste management, personal care, and hygiene were developed in support to the Ministry of Health. Directives targeted the management of dead bodies with cholera, disinfection procedures, control of diseases in cholera facilities, as well as protocols about the removal, transportation, and disposal of human waste in CTCs and CTUs. Water and sanitation specialists supported health partners in setting up cholera centers and in testing water quality and chlorination levels. The Haitian people have demonstrated real commitment and dedication to the development of their own country. The international community did not wait to lend unconditional support to the Haitian authorities, working together to cope with the cholera epidemic. Many lessons were learned, and many others are still being learned. One thing is already clear, though. Together we are better, and together we can work to improve the present and to build a brighter future for Haiti and its people.